Thank you for
So,
joining me.
of course, of course. Like, what is this like? That you're like. Obviously, I know what you're doing, but like, what is the reason behind it? I'm assuming that it's for like to see like other careers and like what's out there, or
Yeah, so my goal is to post bits and like videos from our interview. I'm gonna interview different medical professionals
yeah,
and give high schoolers and like students like me like a chance to hear from medical professionals and like see what their job is actually like and hear from them and like
yeah,
kind of get a direct resource to kind of help them decide what they want to go into and also like hear what they need to do to get there because a lot of the media and like skews different things and like everyone's hearing different things on what to do or what jobs look like. And I kind
yeah.
of just want to have like a direct resource to show people.
Oh, that's great.
Yeah.
Amazing. I think that's very like beneficial because like, when you're in high school, like if you don't have something that really drives you to like do something, and even that drive might be actually, not something you want to do as like, for your career, like it gives you some insight to like what's out there and like you said, like what it
Mhm.
takes. Because some things like sound great, but then, you go to college for it and then you get into it, and you're like, if I knew all of this, like I would have done something differently and it just sucks. Like it's probably nice to
Yeah.
have a little bit more of an idea of like real world like life
Mhm.
and not just like what people see on TV or what maybe little experience they've been exposed to. So that's
Yeah,
awesome.
that's
I
my
love
goal.
that.
Just because I
That's
hear so many different things, I kind of want to hear it for myself and to show other people.
all
Yeah,
good. You're such a good person. You know that?
thank
Like
you.
your personality is like very contagious and you're so smart and it's really hard to
Aw.
find people who have a very positive, contagious, like bright light in the world and then also be smart, like to have that combination. It's amazing.
Aw,
So,
thank you so much.
yeah, of course. Of course.
Okay, I guess let's get into it.
Okay. Well,
Can you please share your full name and your current role or what are you currently studying to be?
yeah, so my name is Alexandra Kleindienst. I am currently a registered nurse at Johns Hopkins, and I am studying to become a nurse practitioner.
Yay!
Yeah.
Um, you said where you currently working, Johns Hopkins. I
Yes.
was just at Johns Hopkins like 2 weeks ago.
Yeah, it's a great facility all around. But there is
Mhm.
also a lot out there.
Yeah.
I in here not to get off the topic, but or the list of questions, but there's so many different healthcare facilities out there in this
Yeah.
area, the greater Baltimore region. So, Hopkins is amazing though. So I've nothing but great things to say about them, but there's also a lot of other opportunities.
Yeah, I shadowed a nurse there for my sophomore shadow day.
Oh, that's great. That's
Yeah.
good.
It was really fun. I really enjoy like getting in the medical setting.
Yeah. Yeah.
Mhm.
Exposure.
How long have you been studying and working in the field of oncology nursing?
So just to expand on that a little bit, I have been a nurse for 12 years now, but I have been an oncology nurse for 10 years.
Mm.
And I'm sorry, what was the second part of your question?
Oh, like how you said it, how long?
Oh, okay, perfect.
What made you want to be on in oncology nurse like specifically?
It's a great question. It's a very personal question.
Mm.
When I graduated nursing school, I really wasn't sure what I wanted to do specifically, what specialty. I knew I always wanted to be a nurse, but as far as specialty goes, I really wasn't sure. I just knew I didn't want to work with like older, like the elderly in nursing homes. So I just applied everywhere. And I actually was a dialysis nurse first. It was like the
Mm.
first job offer I got. It was the most paying at the time compared to all my friends. And so I just took it. And then, unfortunately, at that same time, my best friend was diagnosed with stage four metastatic breast cancer. And I went to a lot of her treatments. I scheduled my work schedule around her
Mm.
chemo and essentially going to them at Mercy Medical Center. I just fell in love with the nurses, just how caring and compassionate and how rewarding. And I just had this calling. I'm like, this is what I'm meant to do. And that's kind of like all she wrote. They were like, all right, you have to work in the hospital first with the oncology patients. And then, because the setting that I was in was an outpatient setting
Yeah.
with my friend. And they're like, after you get, a few years under your belt with that, then come back to us and you absolutely have a job. And I've been in it ever since. And I absolutely love it.
Aw, that's amazing. That's such a lovely story.
Yeah.
Aw. Um, what education, certificates, and licensure were required to enter your field?
So nursing can get a little complicated.
Mm.
I am going to probably expand on that if that's okay with you.
Yeah, of course.
So there are, there's of course medical assistance, which is not a nursing degree. But then
Mm.
above that, you can actually become an LPN, a licensed practicing nurse, with an associate's degree, so like a 2-year degree.
Mm.
And then you can take that a step farther and you can become a registered nurse with the same, associate's degree. Okay, so you have an LPN and RN. Then you have an RN with a bachelor's. So that's what I
Mm.
have. I have an RN with my bachelor's degree, so a 4-year degree. After you get your degree, you then have to take the NCLEX to become so that you can
Mm.
actually practice. So just because you have your degree, you still need your licensure.
Mm.
And so you take the NCLEX, which is an exam. It can be anywhere from 125 questions to 265 questions.
Yeesh.
It's a time test, and it will shut off once it knows either A, you have met the standards that they want, or B, that there's no point of going further because unfortunately you just don't have enough knowledge
Mm.
at that moment to get your licensure, and then you'd have to take it again. So you get your bachelor's degree or one of the other ones, then you have to take the NCLEX. Once you pass the NCLEX, then you can practice as a nurse in the state of Maryland. We are a compact state. So what that
Yeah.
means is once you get your licensure, you can actually practice in any of the other states that are part of the
Oh.
compact states. So there is, and I don't know the exact, but I think that we are approaching 40 out of the 50 states that are now compact, which is really nice. So if you happen to move, there's a big chance that you won't have to take that, exam all over again and get licensed in a different state. But unfortunately, DC is actually not part of our compact. So like if that's close by, if you were to
Yeah.
get a job there. Um, so once you have that, then you can go into like a specialty, and then a lot of this, you can work in general, where you don't need any type of like certification or anything
Mm.
like that. What we call it kind of medical surgical or just like primary care.
Mm.
But there is for oncology, you have to get your two different things. You have to get your OCN, so it is your certification, like your oncology
Mm.
certification. And then on top of that, you actually have to also get your chemotherapy, biotherapy certification as well in order to administer chemotherapy or any of the biotherapies.
Mm.
So to kind of break it, or sum it all up, for me, I have my bachelor's degree as a
Mm.
registered nurse currently, took my NCLEX, got licensed, and then I did 2 additional certifications so that I could not only work with oncology patients, but then also administer their specific drugs. And it can be
Mm.
more simple, depending on what, area of nursing you go into.
Hmm. Is there any like more licensure you have to do to be a nurse practitioner?
Yes. So, in order to become a nurse practitioner, there is 2 different degrees. You can get
Mm.
your master's prepared or a doctorate prepared degree. And the difference between the two is more so research based, as far as like going into and practicing. The PhD or doctorate will allow you to go into more of the research side of things and also
Mm.
teach, of course. But as far as patient care, master's and a doctorate prepared are very similar. There's no limitations as far as prescribing medications and things like that. And then it's the same process. So once you get that degree, you then have to take the boards. And
Mm.
again, it's, several questions that is timed and you have to pass the boards. And again, in order to practice, you can have your degree, but you can't legally practice as a nurse practitioner until you until you're board certified.
Are you studying for the master's or the doctorate?
So I'm currently studying for the master's,
Mm.
and then my goal is to do a bridge program. So they actually have programs where, if you want to do your doctorate, you can easily, bridge and not have to kind of start all over, which
That's
was nice.
cool.
Yeah.
Yeah, how far into are that?
So it's the master's prepared program for me. I'm doing the accelerated. It's 2.5 years, and I'm a little
Mm.
over 2 years in. I am finishing in June of this year.
Oh, that's so soon. Are you excited?
Yes, I'm so excited.
Oh,
It seems like a long time.
mm,
School always seems like a long time for anyone. I think we can all agree with that, but it's totally worth it. And it really does go faster than you think. While you're in it, it feels like it takes forever, but when looking back, it's totally worth it. So like never let
mm.
time or additional certifications, deter you away from, reaching your goal.
Do you have to take the boards in June or like what's the timeline with that?
Great question. So you can actually take it at your leisure.
Mm,
So a lot of times people, you don't want to wait too long after you graduate. So I'm done at the end of June. You don't want to take it immediately because even though you've been kind of preparing it and school does help prepare you for it, it's suggested that you do a like intense review with, one of the online
mm,
certified reviews, and then take it within a reasonable time. So most people will take it between like 2 weeks and 6 weeks post graduation. So like that
oh
way they're
yeah.
still in the, kind of momentum of studying and being, in that mode of like, yeah, like of studying and everything. And that way you're not kind of losing that knowledge and
Yeah.
losing that steam. And then of course you still want to take that like time to review. You don't want to rush anything. So that's usually most people's turnaround time is 2 to 6 weeks. And then it does take time to find out, once you have passed. And then of course the whole job, applying to job process is another beast.
Yeah, well, at least you don't have to take it like so far. At least there's no like time minimum or
Yeah.
maximum.
Yeah, like I think that with like law school and such, I think if I'm not mistaken, and I can't really speak to it, but I'm under the impression that there's only like I think 2 times a year that they offer like the bar, which,
Yeah.
so unfortunately if you're done one point, like and you're not ready for the first time around, that you might have to wait several months to take it. Yeah. So no, this is nice. You can kind of schedule it at your leisure.
Yeah.
And that same thing with the NCLEX as well. You can also, schedule it at a testing center near you. It's typically at a testing center, not that it's not at like, your college or anything. So
Oh,
yeah.
that's nice. Yeah,
Yeah.
that's cool how they do that.
Yeah.
I feel like it'd be so hard if it's like one day you have to take it.
Yes, yes, exactly. Exactly.
Could you describe a typical day in your role?
Yeah, so I am currently in the outpatient setting. I work in both inpatient and outpatient, but we are a 38-bed infusion clinic. We are open, 8 to 6:30, so we're not open 24 hours like the hospital. As a nurse, we are assigned typically 6 to 8 patients in the morning. That doesn't mean that they all come, of course, at once. They are all scheduled timely throughout the day. The patient's treatments can be anywhere from an hour and a half to, 8 to 10 hours, like our entire, they're there the entirety that we are as well. The patients get brought back with the technicians. They get settled in their chair. They get, their IV access, so how they'll get their medications and everything. And then as a nurse, we go in the room and we assess the patients from head to toe.
Mm,
Of course, seeing how they're feeling, deciding if they are, strong enough or and within the physician's, guidelines to get their treatment.
mm,
And then, of course, we're checking all of the ways that we administer stuff. We are checking chemotherapy multiple times. We're handling hazardous drugs. We are also, of course, looking over the patient's lab work. We're their last line. The doctors have
yeah.
seen them prior. The doctors do look at things, but we are the last people to put hands on these patients. And so their lives are in our hands no matter what
Mm,
the doctors say. As a nurse, it's a lot of responsibility, even though that you're not making the orders, you're following through with someone else's orders, and it's your life, your license, and your patient's life on the line. And
mm,
so, it is a hard job because it's not just the caring aspect of caring for someone and being able to have a conversation and holding their hand if they need it, you're, having to critically think and decide, is this like reasonable? Is this safe? Even if the doctor says it is, like, did they miss something? Or did the patient just come in? So then, we do administer, once we decide that, we administer medications that will help them tolerate their treatment, give them their chemotherapy or like blood products. We give, transfusions, hydration, different things like that. And then of course we discharge them at the end of the day. So no, in the outpatient setting, you're not dealing with a lot of drains and
Mhm.
wounds and things like that you would in the hospital. Our main focus with my job is administering their chemotherapy and immunotherapy drugs to, of course, hopefully put them in remission from their cancer or at least keep their cancer stable. Or the third option is is palliative, meaning to keep them in a comfortable state until their time is, unfortunately done here on Earth. But yeah, so
Nice.
yeah.
Yeah, it's always nice seeing like the patient care aspect in hospitals.
Yeah, so I can speak a little. So obviously in the hospital, they're open 24 hours a day. You're
Hmm.
continuing care. You're getting report from another nurse when you come in, about the prior patient, or the patient in the prior shift. You're
Mm.
having to do, depending on what unit you're in, you're having to do wound care, meaning, there's a lot of bodily fluids coming out of
Yeah.
places. There's a lot of smells, so I think that it is really important to highlight that, because a lot of nurses do go into what we call inpatient first, working in the hospital. And
Hmm.
this goes across the board, not just oncology patients, but a lot of just what we call medical surgical patients. So patients that might have heart issues, things like that. They have lots of comorbidities, meaning a lot of different health issues. And so, nursing is not all rainbows and butterflies. It's a lot of blood, guts, and the glory. Like
Yeah.
it's not pretty. And you're seeing people at their absolute worst, and you're dealing with the absolute worst, things sometimes. And you have to be strong to take care of these things that might be, these bodily fluids and such that aren't like, pleasant, while also trying to be there mentally for the patient and their family. Sometimes their caregivers and their family can be harder to take care of, than
Hmm.
the patient themselves, and they're criticizing you for your care. So, but again, they're, in my field, they're so, so grateful. It's so rewarding how grateful these patients and their family members are, and they really take you on as part of their family and part of their, caregivers. And so it is really, really important to absolutely love what you're doing. So,
Yeah, that's like one of the one things that stuck out with me when I was shadowing a nurse was like how close she was to the patients and how like the it's just the patient care aspect is so important, and I don't think like nurses are that recognized because they do all of like the gritty work.
yeah. Yeah. Yeah, no, it is important to,
Hmm.
absolutely love your job. Your patients will know. We all are human. We can read people. If
Yeah.
you don't love your job, they know it. This is not, and I don't know if this is, appropriate to answer this question, but this profession, you absolutely have to have a calling, and you absolutely have to love what you
Yeah.
do. On top of course, having an interest, this is not a job that you take just because it seems nice and you're a caring person, or you have
Hmm.
interest in the, body, the, you like, like the physical aspect of learning all the, organs and the body systems. Like that's
Hmm.
not, you need a little bit of everything with this
Yeah,
job. And more,
100%.
yeah.
How closely do you collaborate with doctors or other nurses or like different members of staff within the hospital?
A great question. So, it's really important. We're actually, have moved forward or more towards what we call patient-centered care, and that really requires a comprehensive care to collaborate, in order to get. So, patient-centered care is you're focusing on the patient and not just like their diagnosis, right?
Hmm.
Beforehand, we would focus on, okay, they have, diabetes. What do we do for diabetes? It's now, patient A has diabetes. How do we take care of patient A with their diabetes?
Yeah.
And so it takes comprehensive care, meaning we are of course working with the doctors directly, but we also are working with social work, we're working with
Hmm.
dietitians, we're working, excuse me, with palliative care, we're working with, the, different religious, aspects depending on what their religion is. And it takes a village. I don't know
Yeah.
why this wasn't done in the beginning, but we have really moved forward with that. And so as
Mhm.
nurses, we're kind of the glue that holds everyone together. We're unfortunately, the middleman in certain
Mhm.
aspects. It can be, rough, but we're the ones that see the patient directly, and then therefore we're kind of like the center of the spoke, and then we're reaching out to all those different avenues that will help the patient and also help their family. The doctors were constantly, of course, with their orders, but you're constantly reaching out to social work. Patients having trouble getting to their chemo or to, or going home from the hospital. Like, do they need a ride, transportation?
Mhm.
Maybe that's what, brought them in the hospital in the first place. They had lack of transportation or lack of
Mhm.
funds to get medical help and things like that. So it's really important once the patient is in front of you that you're reaching out to them and also making sure that the patient is aware of those different avenues to reach out to, those different specialties, because the more that you have of them on board, the better patient outcome you typically have.
Yeah, it's really special. Like I like seeing the shift in healthcare like towards patient-centered care. I think patients like they're a lot more than their diagnosis, and I think it was really nice at seeing nurses take so close care of patients like as people instead of why they're at the hospital. Yeah,
Right,
it was
right.
really
Because
special.
you have to think that, is, we're treating let's say we're treating diabetes, but this
Mm,
patient has no healthcare coverage and is unable to, really, get to the pharmacy for their insulin or afford their insulin, and or afford maybe the oral medication, and the oral medication is more appropriate physically for diabetes of where they're at,
yeah.
but let's say the insulin, is more affordable for whatever reason. Like, you have to look at not just like this is the typical protocol of where we treat and when we treat, but like the affordability, the being able to actually get,
Mm,
get that, and also the safety of the patient. Are they going to be able to follow up every week? Are they going to be able to, and that again, transportation. And if you're not looking at that and you're just treating it like a standard protocol for a type, a diabetic, excuse me, patient, that patient's safety and outcome could be very poor and the safety could
yeah.
be at risk. So yeah,
Mhm.
you're correct.
I know we talked about like the personal qualities of like you actually have to love your job and have like that empathy towards patients. Are there any like key clinical qualities or skills that are essential to be successful in nursing?
That's a great question. The skills are something that you could always learn. The
Hmm.
skills, like, you need to be able to put like IVs in, you need the skills
Yeah.
to critically think, you need the skills to interpret, lab data, you need skills to, and a lot of those skills you will learn in school. So
Hmm.
of course you have to have somewhat knowledge, right?
Yeah.
But those things can be taught. The thing that cannot be taught, the skill that you can't just, teach is to have that compassion, to have the
Hmm.
patience for somebody. You cannot teach compassion. I don't care who you are. I'm the most compassionate person. Not to be, but but you can't. It's just you just can't. Like, I've tried to teach it to people and how to, and it's just not. It's something you're born with.
Yeah.
And so, to answer your question, there are a lot of skills that you do need, but you learn of them in school with your clinicals. When you're in school, even for your undergrad, for your bachelor's or your associate's degree as a nurse, you go to the hospitals, a couple days a week. That's actually was my favorite part. And you
Hmm.
learn these skills. And then, of course, once you get on the job site, they'll also teach you as well, because it depends on what your specialty is.
Yeah.
And there's a lot. I mean, I could talk to you all day about all the skills that you need. But at the end of the day, what you need, that you just naturally need to have, is that compassion and have patience, and also always be willing to learn and be a team player. Like,
Hmm.
we can't function as nurses without our team, without each other. We are, it's teamwork makes the dream work. It's cliche that it sounds, but it's the truth. We say it all day long.
Yeah.
Yeah.
I know you said like you really have to love your job and like you do love your job. Like you're such a compassionate person. Like it makes so much sense in my brain that you're a nurse.
Oh, thank you.
Yeah, I love you.
Oh, I love you. Best.
What's the most rewarding part about working in oncology nursing?
That's a loaded question. Because, of course, that's actually a question that people ask me all the time, why oncology? It must be so
Mm,
sad. But to be part of other people's journey, to like as for a patient to let you into their life when they're the most vulnerable is the most rewarding because they have to trust you. And
mm,
nurses, I mean, time and time again have been voted the most trustworthy profession out there
yeah.
because you are dealing with people's lives. And to see how grateful and how open these patients are with how vulnerable they are is so rewarding. For how thankful they are of you, for the littlest things in life, a warm blanket, and they think that you're, an angel on earth. It's a very rewarding feeling. I went into oncology because of my best friend, but I
Mm,
also, went, and it kind of ties both of these things together. I went into oncology because cancer is, so unpredictable. It's something that we just don't have all the answers to. And there's so many variations, and it's so scary. And I wish that I could cure it. I really do.
mm,
But we know that's just not quite possible right now. I mean, actually, there's probably, I'm sure, someone out there that has that answer. But if I can't cure it, then I want to be part of like helping, patients go up, go to battle, so to speak, in lack of better terms, with it and be, even if I make a small little difference in their care and in their journey with cancer, that's like all I need, like every day. It's the most rewarding thing. And it also makes you look at your own life and be so grateful. And so it humbles me every day um, to come home from work and know that it humbled me each day is it's so rewarding. A lot of people don't have that. A lot of people come, home from work and,
mm,
it's this is hard and this is tough and why me and why is my life so hard? And I have those days, but coming home from being an oncology nurse, you're like, why do I don't need to complain about anything. My life is so good. Like I have it so, made, and I have such loving people in my life, and most people are, relatively healthy. So it also like humbles you. So.
oh, I love that answer. I'm like
Aw.
trying not to cry.
Oh, don't cry.
Oh, that was a really, really genuine and sweet answer, Allie.
Oh my gosh, if you listen back to this interview, I'm probably like all over the place, but I'm just speaking from my heart. So
Oh, I love that. Adding on to like the challenges of work, what are some of the greatest challenges or difficult aspects of your job?
yeah, so actually to build off of what we were just talking about, of
Mm,
course, it is probably like the hardest thing that I have ever had to do, is taking care of patients when you don't get the good news, to have, stand there and and sit with them and hold their hand of, why me? Why did cancer pick me? Or why did cancer pick my daughter or son?
mm,
It's heartbreaking, and you don't have, the perfect answer because everybody's different with how they deal with this information. And so it makes it extremely hard to sit there and look at these innocent people and, tell them, like, you can't tell them it's going to be okay, but you can tell them
mm,
that you're going to be there for them. But it's heartbreaking because you think about it being, if you were that person or if that was your family member. So sometimes you just feel so helpless
yeah,
in those situations. Which makes it really hard, or you get really close, like you had mentioned, the nurses get really close with the patients.
yeah.
It's really hard. And when it is that moment, in their life that it's time for, unfortunately, them to move on to like the afterlife of whatever that may be, and
Mm,
what they believe in. Um, and it's hard not to be attached to the patient and their family and, have to say your goodbyes. But that's also something that you are born with, but you also learn you have to have a spine a little bit and build that callus, so to speak, because if you let your emotions take the best of you, you wouldn't survive being a nurse. Like, you would just come home crying every day because
yeah.
it is sad, but it's very rewarding. And there's also very positive people go into remission. They're so thankful. They come back a year later and they're like, look how good look. And like, I'm doing great and my kids. And that's like, that also is the rewarding
Yeah.
aspect of it as well. So
It's like a
yeah.
double-edged sword.
Yes, exactly. And you don't know what you're going to get each day. So
Yeah.
yeah.
Are there any aspects of your profession that students or new nurses would be surprised about?
Yes, I think that like number one is time management. I think that they don't realize
Yeah.
how like like even when you're in the hospital, like it's a little better than you're in the hospital because, it's 24-hour care, but time management is a big kind of slap in the face for
Yeah.
people. I think they don't realize because they're so focused on learning skills that they then don't understand that time management is really what makes your day kind of make or break your day. Um,
Hmm.
and then, teamwork, like it's, you just because you have your set of patients, like you have to be a team player. I think sometimes people get surprised by that. Like, you can't just because you're having a good day does not mean you can't offer that help because there's going to be a day that you need it as well. And then lastly, I think that people are a little surprised on like how much of that again, like to not go into detail, but guts and glory that there is. There's a
Hmm.
lot of like if you're working in the hospital, there are jobs with nursing that don't have all of that. But a lot of times, especially as a new grad, you want those jobs to learn. And it's a lot of bodily fluids. That's a lot of things that you're having to deal with that, like, yeah, you might have seen briefly in clinical, but and I think that people do get surprised by that for whatever reason.
I saw a lot of that on my shadow day. They put me in
Yeah.
the colorectal unit.
Oh, yeah,
Yeah.
that's perfect. Yeah, throw you into the
Yeah, right
fire.
in.
But that's great though. That's a great, and again, like you
Mm,
aren't stuck in that forever. Like if
mm,
it's not your thing, there are a lot cleaner nursing jobs, so to speak. Working in offices and things like that, and that might be your forte. But I
yeah,
think that it's really important. You're going to talk any nurse that you talk to, they're going to say which is exactly what I was told. You have to have a good foundation of working in the
yeah,
hospital, and those are various stages of what we just talked about. So.
yeah. What advice would you offer to individuals considering a career in nursing?
Um, Actually, you're a prime example. I would say, number one, if you want to get into the medical field, or especially nursing, is to go shadow somebody. I think
Yeah.
that will help save, you don't want, nursing school is a program, like
Mm,
you don't want to sign up for a program and then start and then realize that this isn't meant for you. You get to clinical. I mean, it's heartbreaking. School's expensive, it's time. And it is a lot of pressure for anybody, in their sophomore, junior, senior year of high school, deciding like what they want to do in life. You're young.
yeah.
And I think that, I can speak to any type of career. Like anything that you think you have a little bit interest in, go shadow somebody, ask
Mm,
somebody. Because then therefore, even that little bit of light, even if it's a couple of hours, might make or break your decision. Sometimes you might be like, I don't know, but like I think for the most part, you're gonna be like absolutely like have interest in this, or like
mm,
there's no way that I could deal with that. I think that like nursing is actually one of those that people would shadow and then realize, oh my gosh, like I didn't
yeah.
realize how much this requires. And this is not something that I can do, or,
Mm,
this is really interesting. So I think that shadowing in high school is number one. And then number two, if you do apply to nursing school, you can still ask to shadow even when you're in school, or
yeah.
maybe if there's like a specialty that like you want to see oncology, you want to see orthopedics, but you're not there with nursing school, ask, especially when you're in clinical, have good relationships with the nurses and the doctors that you do come in contact with in school, or family, friends, and things like that, so that you can get those like experiences.
Yeah, I agree so much with shadowing. Like my sophomore shadow day, like so many of the people knew like or found out like they wanted to go into the field or they absolutely did not want to go in.
Yeah. I think like I mean I think for any like career that's there, but for nursing, I think that will like cut, I think it'd cut out a lot of people just
Yeah.
shadowing, like just to be like, okay, like I know it's I think I keep going back to it, but I so many people are like, oh, my daughter or my son was gonna do nursing school, and then they realize like the blood and all that. I'm like, wait, like
Mm,
why would you want to become like a nurse if you can't like
handle
because the
it.
thing is like you have when you go through nursing school, even if you want to come out and say, I'm gonna work in a primary care office, where there's not really like a lot of like I'm not going to be drawing the blood. I'll just be, whatever. You still have to get through nursing school. Like
Mm,
you still have to practice IVs and do wounds and all of that through school. So even if
mm,
you plan on not, even if you want to go into aesthetics, like you still have to get through school.
yeah.
And there's no way that you're going to be able to do a couple of years of school in clinical
Mm,
and, deal with that. So I think that, yeah, shadowing honestly is the number one. And then of course
mm,
like research.
yeah.
There's a lot of like influencers out there that, on social media and stuff that are, now of course, want to follow somebody who's an actual nurse, but that you can like learn from that too, whether it's on, Instagram or, YouTube or things like that. So,
Mm, yeah.
so
Would you recommend oncology nursing as a career path? Why or why not?
I would recommend it if you have a calling for it.
Mm,
Think that I can tell you right now, the biggest turnover in our clinic, not that we have a big turnover, but over the last 10 years that have been between Mercy and Hopkins, is because they were nurses that did not come from oncology. They, just had an interest. They said they what more so in the outpatient setting. They were like, oh, it's outpatient, it's a little bit better hours. I don't have to work the night shift. And, it seems a little more cushy of a job, and then realize that it's not a cushy and you have to have a heart for oncology, or else
mm,
you're gonna hate the job, and you're also not gonna get along with all the other nurses. Not in a mean way, not in,
mm,
some type of bullying way, but because you don't have that heart, like it's going to show, and your patients are gonna see it very
yeah.
quickly. For the most part, our management and stuff, they when they interview people, they also have the nurses interview the possible new employee, and we can easily read. You have to have a
Yeah.
heart. A lot of other specialties, you don't need that. I think that, like, you don't might not have a calling, you might just have an interest, like orthopedics,
Yeah.
but oncology in like palliative, hospice, all of
Mm,
that, you have to have a heart. You have to have a calling, whether it's a personal thing, whether it's just something that you feel like you've been born with, it really speaks to you. It has to be one of those things for oncology,
yeah. That
like
makes
hands
sense.
down. Yeah, most of us, I would say, have a personal experience with it, whether it's, like a
Mm,
family member or something like that, or even a patient, like a patient that, that came across, in the hospital in a regular medical surgical unit, had cancer and, whatever reason, and then you had a connection with that person. But yeah,
okay. Thank you so much for joining me.
of course. I'm very flattered. Thank you for asking me to do
Yeah, of
this.
course.